to my first patient of the day doesn't mean I can skip the next 10, okay? So I had my patient number 1, now I got patient number 2, all right? Dr. Shaker, just in case you forgot, instructor for the class, and you are?
Richard Fulbeck.
Okay, and I believe, do you like to be called Ricky?
Yes.
Okay, perfect. All right, so that's another way for me to confirm, all right? And so again, we're going to continue to show bony landmarks, the ones that you just found on the skeleton. I'm going to actually show your class how we find them on you.
Okay.
Okay? And so that means I'm going to have to use my hands, a little bit of pressure, okay? While we're at it, hopefully I can warm them up. Shouldn't hurt. We're doing this for educational purposes, but if I touch something that's uncomfortable, please tell me, and I'll make an adjustment.
Okay.
Do I have permission to put my hands on and find these landmarks?
Mm-hmm.
Terrific. Okay. So, coracoid. Can we all visualize where it is? It's on the front of the scapula, but it's really deep, so it's hard to find. Couple different ways to do it. I'm going to put my non-palpating hand on the back of Ricky's upper body so that I can get a little counter pressure. I'm going to go sternal notch over to the clavicle. Now if I go to the acromion, I'm above the head of the humerus. I'm too far lateral, okay? So I need to go to the lateral clavicle. You can kind of see the head of his humerus. The coracoid is going to be somewhere in this valley, okay? And it's uncomfortable, and I think I'm on it, but I don't know for sure. So you're going to do me a favor, buddy. Put your hand, your right hand on your tummy, and push your hand into your tummy. And you know what? I wasn't quite on it, okay? Now I slide down, and now I'm on it, okay? Is that uncomfortable a little bit?
Yeah, a little.
Okay? So that's how you're going to find your coracoid. When we swap out, you guys can start with that one and then go on to the lower extremity. Okay? Now, do you mind slipping off at least your right shoe? Okay. And you're going to lay on your back. So I'm going to go through the bony landmarks for the lower extremity. Perfect. Need a cameraman. All right. So I'm going to have you put your hands here. Are my hands okay, warm enough?
Yeah, they're a little chilly, but they're still good.
Okay. Can I raise your shirt?
Yeah.
All right. Perfect. Okay. The iliac crest, we want to use this part of our hand. Okay? So I'm going to go rib cage. I'm going to sink in. All right? Hopefully he's not ticklish. So now, this part of each hand, rib cage sink in, is on right iliac crest, left iliac crest. Okay? And the reason why I'm having him lay down is I need him to relax so that his abdominal muscles will let me sink in. Now I'm going to slide my fingers anteriorly, and I'm on the right and left, right anterior superior iliac spine, left anterior superior iliac spine. Okay? So iliac crest to the anterior superior iliac spine. Now, you do not have to palpate the pubic symphysis on each other, but I'll show you how you do. Ricky, do you know where your pubic bone is?
Yeah.
Can you put your finger on it for me?
Right here or something?
Probably a little bit to either side, close. Okay? And so I'm on the left side of the joint and the right side. If you want to practice this on your own, you can. It will not be part of our first practical. Okay? All right. The greater trochanter is actually easier to palpate from the back, posterior view, but I'm going to show you how you can find it from the front. Okay? Can you bend your knee? Put your foot flat. Okay? And I would be standing over there and I would be blocking the view of the video, okay? So I'm going to slide down. I'm on the epicondyles of the femur, medial and lateral, lateral, medial, okay? Can you bend and straighten your knee for me? So bend and then straighten, okay? So that's how I'm going to confirm. Now come on back up. I'm going to slide lateral until I feel a bump. Straighten out your knee for me. Okay? And now roll your leg in and out. That's the trochanter. All right? So I'm going to show you again. Bend your knee back up. Okay? I'll be out of the view. I'm going to slide down. I think I'm on the epicondyles. Now don't kick me, but move your foot toward me a little bit. Okay? Epicondyles. Go ahead, bend. And now, what I did was I slid in a straight line until I felt another large projection. Straighten out. And now go ahead, turn in and out. Okay? Got it? Greater trochanter. All right. We can see Ricky's patella. Okay? Notice I'm not pushing on the anterior surface. I'm just feeling around it. So here's the top of the patella. Here's the inferior part of the patella, the medial and lateral. So just try to feel all around the periphery. Okay? The tibial tuberosity is right below the inferior part of the patella. And again, it's a bump. All right? I could have done two things. I could have slid up the shin. There's the tibial tuberosity. Okay? You know what? Mind if we take this down?
Yeah.
Mind if I take this down?
Oh, yeah, I don't care.
Okay, just like that. Here's the medial and lateral malleolus. Medial and lateral malleolus. Step on and off the gas pedal for me. Make sure that I'm on the tibia and the fibula. I'm going to stay on the lateral malleolus and slide up until I feel a projection. That is the head of the fibula. Okay? Got it? I think I hit them all. Go practice for 5 minutes. Okay? Thanks, Ricky.